Hey Tim, I'm making this quick video just because you mentioned that you would appreciate people, giving you a friendly pie to the face on Dave Rubin and Joe Rogan on certain topics if you were wrong and maybe you didn't know it, or maybe there's a couple of details you missed. Just real quick on immigration, you mentioned in several videos, several times, that if we can't afford to give immigrants health care, then how in the world, if we can't afford to give Americans health care, how can we import more immigrants and give them health care as well? It's very simple. There's two answers. One is economies of scale. Economies of scale mean that the fixed cost of making certain machines and certain buildings is used either way. So if you're only treating one patient and you have to build a whole hospital, then that's going to be a very expensive treatment. Simply because you have to build a hospital, you have to do this, that, the other. Now, once the hospital is built, you can move to two patients, and the costs get cut in half. You can move to three, four, five, and it actually gets cheaper per person. Now you're still bringing in more money altogether, but per person gets cheaper because you're amortizing costs over more people over more time. So more people, more immigrants who come in means they're paying into the system, means that these machines, these fixed costs are being amortized over more people. So insurance should go down for everyone. Second of all, even if you think, well, there's amortized costs, but there's still more costs because maybe it'll be subsidized by U.S. taxpayers, maybe this, maybe that. So the other way to think about this is very simple. That the majority of all healthcare costs you'll ever incur are in the last 2 to 5 years of your life. Is old people who are about to die, who require a ton of medical costs. Either it's labor from doctors and nurses, or whether it's pills, whether it's cancer, whether it's this or that. The vast majority of immigrants coming into the United States are very young. So since they're paying into the system, basically in the United States, since healthcare companies are mandated to cover certain expenditures, they have to charge everyone more. So in the United States, healthcare, the insurance charges everyone a fixed rate, and your employer covers some and you pay some of it, and almost no one actually uses as many medical resources as they pay into the medical system. What happens is older people are using all of those resources. Very old people who are in their 80s, their 90s, are using a ton of medical resources, and people who are young in their 20s, 30s, 40s, 50s are paying all of that cost. Now, since we have much younger immigrants coming in, we actually won't have to worry about their medical costs for a good 30 years, 40 years. And by then, hopefully, technological improvements will have made treating these diseases much cheaper anyways. It's basically we get to push the problem very far into the future, decades into the future, and give technology a chance to catch up. So what you're going to have is if you pay, tons of people pay $500 a month for healthcare. So if every immigrant, if 100,000 immigrants come in, they're all paying $500 a month towards healthcare. That's a lot of extra healthcare that dollars are flowing into the system. They're going to go to still the same fixed number of old people who are drawing resources. So it should actually be much cheaper. Now the only problem comes in when you get governments, either local governments or federal governments, coming in and saying, hey, we feel really bad for these immigrants. We're either going to pay, give them subsidized health care, or we're going to, change the system to make it cheaper for them. This is something that should not happen. There is no problem with I don't think libertarians or conservatives, I think even Democrats could be persuaded to say, hey, if you come to this country, you can't use government resources for 5 years or 10 years. You have to pay into the system, but you can't draw out of it. And that's the cost for coming to this country. You can't get food stamps, you can't get welfare, you can't do this or that. Part of the problem is that when you offer free incentives to people, there's now an incentive to immigrate here, an artificial incentive. Normally the incentive should just be high wages or better living conditions. That's a high enough incentive for some people to come here, but once you add in free healthcare, free housing, this, that, the other, a lot of government subsidies when American citizens vote for these, they are trying to vote for Americans to get these. No one votes for a new housing development to come in and expects that those hotels or those apartments are going to go straight to people in another country who are going to see those uh, free living arrangements and move here just for that. I think voters would be really disgusted if they found out that's where their money was going, because it's not for those. There's a ton of people in the United States we do have to help. So I think it's a really good compromise, and one that not a lot of people talk about. A lot of people buy into this framing where, for Democrats, they say, well, open borders, just come in and we'll give you the world. We'll give you everything in the kitchen sink if you come here. And you have Republicans who say, no, 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 fewer immigrants, they're hurting our jobs. It's not, you don't have to, it's not one or the other. It's not black and white. You can say, okay, well, let's make it easier for people to come here legally. That's the one thing. What if to get your citizenship in the United States, it costs 10 years and $10,000? Like, you were living here, right? Everyone who was born here, but in order to become a citizen of the United States, to get, First Amendment protections, to get the right to vote, to get all the things we have as American citizens, costs you 10 years and $10,000. How many Americans would realistically, starting at 21, let's say, and so the soonest you could become a citizen was, 31, and you had to pay $10,000. How many U.S. citizens would, today, would have gone through that process to become a U.S. citizen? Very few. Very few. And it's the same thing with Mexico. It costs an extreme amount for people to come here from other countries. It's such a big bureaucratic cluster. It's such a mess that it doesn't make sense for people. It doesn't make sense to wait 10 years so maybe you can get chosen by the visa lottery. I know actually several people who are grad students here in the United States, and they are really disappointed because they come here, they learn English, this is where they want to stay, and they can't stay because they weren't picked in the lottery. It's kind of sad because we're taking these people with a ton of education, we're taking people literally in Ivy Leagues and sending them out even though they'd like to stay, the best and the brightest, because they weren't chosen in the lottery. Anyways, that's neither here or there. The whole thing is that you shouldn't worry about immigrants, ruining our healthcare, or you mentioned our communities too. It's very simple for that as well. If more people move, when you said, hey, how are we going to have more people move to New York or Los Angeles? They're going to stress the public waterways, they're going to stress the sewer system. It's very simple, that you have market for it. So first of all, your argument isn't an argument against immigration, it's an argument against population growth. With that same logic, we could tell people to stop having kids because hey, you might stress the sewer system. But the correct answer isn't tyranny, isn't to tell people where they can and can't go. It's not to tell people how many kids they can and can't have. The correct answer is to have people, if people are imposing costs on the system, you simply just have them pay for those costs. So you say, hey, people at New York, like we're gonna, you can do it in several ways. So if you're talking about on the level of like a condo, of like local governments, like a homeowners association, you say simply like, hey, we're gonna put a 3-person max on every apartment, and if you have more than 3 people living in this apartment, you pay an extra fee. Why? Because we're gonna pay more for, we need to upgrade the sewer system, we need to do this, we need to do that. That's pretty simple. And even at the municipal level, same thing. You can just say, hey, we're gonna, approve these new developments or these new housing units, but we're gonna have a little extra tax on them because we need to expand the waterway. This is already how things are done with licensing and stuff whenever they approve new developments. So whenever you have extra population growth, it's fine. You just have to take more money in from that population that's expanding, and say, hey, you have to move here, you can move here, but since you're imposing extra costs, it's going to cost you a little bit more. And most people are perfectly fine with that. It's really not that expensive. Anyways, long story short, immigrants, a really good way to make everyone happy is make it much easier to come to the United States. Not 10 years and $10,000, but 1 year and $500. If that was the process, you fill out an application. As long as you don't have a criminal record, you're good to go. As long as you, what we can even say, as long as you pass an English test and you have a no criminal record, you're good to go. All of a sudden, you wouldn't have people making that life-threatening trek through the desert. And people think this is cheap. It's like $1,000 to pay someone, a guide, to take you from Mexico to Texas. It's very expensive, but it's much cheaper than paying $10,000 for you, paying $10,000 for your wife, doing this, that, the other. Our immigration system is ridiculous. Fix it up, and people won't be coming illegally. illegally. Anyways, reply back if you want. If you just heard this and listened to it, hopefully you have some thoughts. If you want to send a text, not a text, but maybe like something written, I'll read that and reply as well. It's a subject I have studied extensively and have extensive experience with. So have a wonderful day, and thanks for listening. Bye.